Good morning, I'm Mabel Jong, and welcome to the day one coverage of the World Healthcare Congress here in Washington, D.C. Our first interview of the morning is Kurt Janavitz, who is CEO of Integrated Health Network of Wisconsin. Good morning, Kurt. How are you?
Doing great. How about you?
Fantastic. Thank you so much. Well, first, let's start with what Integrated Health Network is.
Sure. We're a super clinically integrated network of about 53 hospitals and 8,400 clinicians covering the entire state of Wisconsin. We've been in operation since about 2010, and our goal is to really transform the way healthcare is delivered in Wisconsin, improving quality, reducing costs, and really positioning ourselves as that trusted healthcare management partner to employer groups and also to payers to help really manage care appropriately.
Okay, and how have you grown? I assume by partnering with entities to create a more integrated system?
Correct. So we have 8 different health system partners. We started with a core base of 4 early on and have pulled in other folks across the state. So we have everything from a major academic medical center with Freighter, a major teaching physician group in the Medical College of Wisconsin, and then a host of community hospitals and large integrated delivery systems as well.
Has it been challenging to keep the momentum up for the integration and keeping really the goals aligned amongst all of those different entities?
That's one of the biggest challenges that we face, as you can imagine. There aren't a lot of folks that look like us, especially as of a couple of years ago. We were kind of pioneering. There are more super clinically integrated networks. So when I say super, I just mean that, the number of systems involved. But it is really challenging. They all have their own strategies, agendas, diverse interests, et cetera, and keeping them rowing in the same direction is challenging. That being said, the ways we do that are a few. One is through very strong governance. So as part of our management and governance structure, the CEOs of each of the health systems have to have a seat on the board as well as one other senior executive. And some of those folks spend 10 to 15 hours a month on Integrated Health Network, and you can imagine how busy they are with sort of their full-time jobs. The second piece that really glues everyone together is the financial integration we've developed a funds distribution model. And so as we get funds in from various payer contracts, shared savings contracts, we have a common way of distributing those among members there's a component that's measured on quality, one component that's measured on total cost of care relative to a benchmark, and the other on improvement. And because we have that common financial integration, it really makes the members accountable for performing on contracts. And the third piece is really communication. We can't communicate enough. We have, outside of even our board and committee meetings, there's lots of informal communication that goes on to just, again, make sure everyone understands what we're doing and we're all rowing in the same direction.
How has this funneled down to the people on the street, to the patients? Have you noticed a more efficient delivery of care, for instance, or in cost?
Absolutely. So we've had pretty nice results so far in terms of those two features. What we're seeing originally is we're really focused on utilization and quality. So on the utilization front, we've started with our self-insured owner members who have their own health plans managed by us and a pocket of direct-to-employer arrangements. And what we've seen with those folks who remain engaged with our model are significant decreases in readmissions, significant decreases in ER visits, and our quality metrics have been strong as well. So we have had a few press releases with United and Humana that have touted the improvement that we've seen in both preventive care benchmarks as well as chronic care management outcomes.
And what do you think the future will hold for maybe the next 3 to 5 years for integrated health?
Well, our goal is to really, right now we have a care model that's focused on transitions of care. So if you have an event like in the hospital, for us to connect with one of our care navigators to make sure that you're going to follow up with your physician at the right time, take the appropriate medication, et cetera. We have a complex care management program right now where we take for 6 different disease states, and for those folks who have the highest risk scores, we help put them into a care navigation model. But really, you said what's going to happen in the next 3 to 5 years, morphing that and really taking on more payer-like functions, to be honest. So utilization management, disease management, et cetera. As we move into risk, because our goal is to take on more risk from payers, you have to excel in those functions in order to make it work and integrate the financing and delivery.
Of course. This is your first time speaking at the conference.
Yes, it is.
What have your messages been here?
Absolutely. One of the messages has just been it's really, healthcare organizations, providers are clearly the ones best positioned to manage care, and the payers acknowledge that. So one of the reasons so many payers are contracting with us on a shared savings type arrangement is the engagement we can get with their members. So again, if you have an adverse event, you're in the hospital, you have an ER visit, if you are back at home and you receive a call from a large national payer from a random call center, you're very unlikely to call that individual back. But if, on the other hand, I had hip surgery and I go in and it's my own provider's office, my own physician's office calling me and saying, hey, are you going to come back for your repeat visit? Are you taking your medications? Are you engaged? The engagement rate is going to be much higher. So we see engagement rates with our program. They vary from 40 to 65%, whereas with national payers, you'll see something in the high single digits, low double digits. So they acknowledge it. The employers acknowledge it. So one message, again, is we're in that right spot to take care of patients. The second thing, though, is that trying to go direct to employer like we are is a very challenging task, because you have to do many of the things that a payer's done, and you have to make it simpler. It's very simple to an employer group and to a broker. So you're thinking about things like stop loss and pharmacy and on-site and near-site. So that's not a task for the faint of heart. And so if you're going to get into it like we are, you really have to be prepared to make the investment and to be able to work on this through the long haul.
All right, Kurt Janavitz, thank you so much for your message today.
Thank you.
And I'm Mabel Jong. Thanks for watching. More to come.